Good day everyone, I'm London Pangilinan, student nurse from BSN 3H of NEST. And for today's video, I will demonstrate administering of oxygen by nasal cannula. Our goal here is for the patient exhibits an oxygen saturation level within acceptable parameters. For the equipment, check for oxygen delivery device as ordered by healthcare provider, oxygen tubing and consider extension tubing, humidifier if indicated, sterile water for humidifier, an oxygen source, then oxygen flow meter and appropriate room size. For the implementation, bring necessary equipment to the bedside stand or overbed table. Then perform hand hygiene and put on PPE if indicated. Identify the patient. Then close curtains around bed and close the door to the room if possible. Explain what you are going to do and the reason for doing it to the patient. Review safety precautions necessary when oxygen is in use. Then place no smoking signs in appropriate areas. The sign warn the client and visitors that smoking is prohibited because oxygen is combustible. Good day po ma'am, I'm London Pangilinan, student nurse po mula sa NEST. Pwede ko po ba mamalaman kung ano po ang inyong pangalan?
Ako po si Cannula.
Okay po ma'am, Miss Kalilap. Ang ating pong gagawin ngayon ay ang pag-administer po ng oxygen via nasal cannula po. So ma'am, ginagawa po ito to deliver low to moderate levels of oxygen to relieve hypoxia po. So ma'am, let's start na po. Connect nasal cannula to oxygen setup with humidification if one is in use. Adjust flow rate as ordered. Check that oxygen is flowing out of prongs. Checking flow before use is needed to provide prescribed oxygen to the client. Place prongs in patient's nostrils. Place tubing over and behind each ear with adjuster comfortably under chin. Alternately, the tubing may be placed around the patient's head with the adjuster at the back or base of the head. Place gas pads at ear beneath the tubing as necessary. Proper position allows unobstructed oxygen flow and eases the client's respirations. Adjust the fit of the cannula as necessary. Tubing should be snug but not tight against the skin. This is to prevent the tubing from getting out of place accidentally. Ma'am, kakabit ko na po. So, ma'am, higpitan ko na po. Ma'am, okay na po ganyang higpit? Wala pong discomfort or irritation po? Then, encourage patient to breathe through the nose with the mouth closed. Breathing through the nose inhales more oxygen into the trachea, which is less likely to be exhaled through the mouth. So, ma'am, I encourage you po to inhale through your nose po while closing your mouth po. Kasi po, pag sa nose po kayo nag-i-inhale, mas marami pong oxygen ang mapapasok po sa trachea nyo po. Reassess patient's respiratory status, including respiratory rate, effort, and lung sounds. Note any signs of respiratory distress, such as tachypnea, nasal flaring, use of accessory muscle, or dyspnea. Then remove PPE if used, then perform hand hygiene. And next, document. Put on clean gloves, remove and clean the cannula, and assess NEUST at least every 8 hours, or according to agency recommendations. Check NEUST for evidence of irritation or bleeding.